Hi everyone, welcome to Introduction to Sociology for the week of April 20th through the 24th. This week we're going to work on gender and sexuality. We only have a couple more weeks together, so I thought it would be nice to give you another little pep talk, some optional encouragement that of course you're free to skip. None of this will be on the test. But if you'd like to be encouraged, I want to start by reminding you that you are doing fine in my class. No matter what your grade is right now, I want to encourage you that given the circumstances we're under, I'm going to make the material as approachable as possible and the tests as doable as possible. You don't have to worry that the tests are going to be hard or tricky. Everything is going to be fine. If you're having trouble, I'm here to help you. But I want to assure you that I'm doing my best to adjust my expectations of what you're going to accomplish in this class. I also want you to know that I care about you whether you do well in my class or not. However you do in this class, I hope to see you in future classes because you're all delightful and I care about each and every one of you. I don't want you to think that if you make a C or a D in this class, that means I wouldn't be delighted to see you again. I care about you personally regardless of your grades. I also want to encourage you that your other professors also care about you and will try to help you if you reach out to them. Not every professor is as open about their feelings and compassion for students as I am. I tend to wear my heart on my sleeve, but your other professors are doing this job for the same reason I am, which is that they care about you. So if you're having trouble in your other classes, level with your professors. Ask for what you need and give them the opportunity to show up for you. Finally, I want to remind you that you are more than your accomplishments. I've said this to you before, but I really want to reinforce it, which is no one who loves you right now will love you any less because of the grades you make, or any more for that matter. You are a big person. You are an entire human being who matters regardless of what you achieve. This is important to remember now because our usual markers of how well we're doing are not really available to us. We can't check in with classmates and faculty the same way we're used to. It's difficult to know exactly how well we're doing from moment to moment, and sometimes it feels like we're working in a void, with no one seeing what we do, and like what we do doesn't really matter. What you do does matter, but it's not the only thing about you or the most important thing about you. I'm sure you're doing just fine, but even if you're not, you're still a valuable person. And finally, I'd like to give you some unsolicited advice you didn't ask for. Um, these are things that help me stay grounded and centered in times when maybe I'm feeling a little bit awash. Maybe I'm feeling a little bit like I don't know how I'm doing and I don't know what's important right now. Some things to try. You could call a loved one you haven't talked to in a while. This could be an elder relative, a sibling you don't talk to as much, a friend you haven't heard from in a few years. Remind yourself that you have connections with people besides the people most immediately around you. Remember that you matter to people in ways you don't often think about. Another thing you can try is to ask someone you trust what they love about you. Find someone you believe will tell you the truth, and someone you believe has your best interests at heart, and ask them to just tell you why you're important to them, why you matter in their lives. And what they're going to tell you is that you are a valuable person to them, that you make them feel good about themselves, that you make them want to be better people, things like that. They're absolutely not going to tell you that they love you because of your scholastic achievement or that they love you because you're such a diligent worker. They're going to tell you about your humor and your caring spirit and your generosity and your intelligence and your humor and all those other wonderful, stable things about you that are not affected by this epidemic at all. So this is my encouragement to you for this week. I hope it helps, and if it doesn't, feel free to ignore. I'll never know. So today we're going to talk about gender and sex and sexuality, which are all different concepts. More on that soon. This topic tends to be the one that generates the most controversy in the course. This is because we have a lot of values attached to ideas around gender, sex, and especially sexuality. We attach a lot of personal meaning to our own gender identities, which is fine and appropriate. We also think that our sex and our gender tells us a lot about who we are as people, which may or may not be true. I'm a sociologist, not a philosopher. But we have a lot of deeply ingrained values around these ideas of gender, sex, and sexuality. And so thinking about these things from an outsider's perspective, applying Mill's sociological imagination to gender, sex, and sexuality presents a special challenge. It really asks us to set aside our foregone conclusions of what we know about ourselves and the meanings we attach to things, and to think about things from a beginner's perspective, to think about things as they are, rather than things as we've been told that they are. And not to say that what we've been told is necessarily wrong, but when we take things for granted, there are subtleties that we miss. So I'm asking you to really put on your sociological imagination and look through the sociological lens at the things we're about to talk about in this lecture. So the first thing we need to do before we discuss gender, sex, and sexuality is get some terms under control. Get some terms in our toolbox. And I think a fun way to do this is through this little infographic. This is a cartoon created by an artist called The Genderbread Person. And it uses the metaphor of a gingerbread person to teach us about sex, different elements of gender, as well as sexual attraction. So the first thing I want you to look at is sex. It's the little hormone symbols located between the genderbread person's legs, which is where we think of primary sex traits existing. And so we see, if we look at the little legend on the right side, that biological sex relates to femaleness or maleness. It relates to our primary and secondary sex traits. If you look at the very left-hand side of the spectrum, you can see that some people may have really neutral or ambiguous sex traits, meaning they have traits of both sexes or traits of neither sex. We'll talk about that in a minute. And then we have arrows going toward femaleness and maleness. So we talk about sex traits as if they're definitely one thing or another, but in fact, there's a wide range of presentations of primary and secondary sex traits. We'll talk more about that in a moment. Next, we have gender identity. How much a person feels that they are one gender or the other, how much they identify with one gender or another. That's located in the brain. Gender, or we might say in the mind. Gender identity relates to how much one feels like a woman or like a man. As you see on the left side, some people don't really identify with either. And some people identify really strongly with being a woman, and some people identify really strongly with being a man, with people falling at all locations in between. So I could feel that I'm a woman, but not feel that that's very important to me, which would put me somewhere in the middle of this woman arrow. Or I could feel that maybe I don't really identify with being a woman or a man, which would put me here where this gray no-go sign is. Gender expression is how we enact feminine or masculine gender roles. So I could agree that I'm a woman, for example, but really embody masculine gender expression. Um, I could feel like a woman who is just masculine of center. Or I could feel like a man, but have very feminine gender expression. So these two things tend to overlap a lot, gender identity and gender expression. That is, most people who feel like women enact feminine gender roles and men enact masculine gender roles, but not all the time and to very varying degrees. So some men act a lot more masculine than others, and some women act a lot less feminine than others. And that's how gender expression differs from gender identity. Finally, for any person who's at any point on any of these continua, um, sexual attraction and romantic attraction can exist at any point on these continua. So, for example, any person, regardless of their anatomical sex, regardless of their gender expression, regardless of their gender identity, may be attracted to men, to women, or to nobody at all, or anywhere along those lines. So, this is not, it's important to point out, a value statement. None of this relates to good or bad, or right or wrong, or better or worse. These are just descriptions of the way we can conceptualize gender. This is a description of the variety that exists in anatomical sex, gender identity, gender expression, and sexual and romantic attraction. So, sociologists and psychologists seek to really understand how people experience gender, and this is a pretty good illustration of how we understand that. The first idea I want us to talk about is sex. We often use the word sex and gender interchangeably, but for our purposes, sex will specifically refer to physiological differences among the sex traits of human bodies. So we typically think of sex in two different ways. We can think of someone's anatomical sex, that is the arrangement of their primary and secondary sex traits, where primary sex traits would be things like genitalia, and secondary sex traits would be things like hair growth and musculature and breast and hip width. And we can also think of a person's genetic sex. We rarely think about this, or certainly never check for it. But if we analyze the human being's genome, we can tell whether they have two X chromosomes or an X and a Y chromosome, or some variation. XX and XY are certainly the most common arrangements of chromosomes, but some people are, for example, XXX, and some people are XYY, or even XYYY. There are a number of different variations on this that can exist. Most people are either XX or XY. And the significance of this, or the relationship between these two ideas, fetuses begin looking what we call proto-female, meaning early in a fetus's development, there's really no telling what sex the baby is going to have unless you do genetic testing, because the primary sex traits look feminine, and the secondary sex traits won't develop until well after the child is born, generally into puberty. But what happens in the uterus while the fetus is developing is that if the child has XY chromosomes, an androgen wash will happen. An androgen wash is a flood of hormones that happens in the first trimester of pregnancy that basically signals to the developing fetus to develop masculine sex traits. And so that's when gender becomes, or sex of a baby becomes determinate. See, I just use the word gender as a stand-in for sex because that's how ingrained it is that those ideas are interchangeable. We all need to watch that. Now, I want to point out that we have socially defined sex as a binary, with male people on one side and female people on the other side. And to some degree, this makes sense. We see a lot of what we call sexual dimorphism among human bodies, meaning that male bodies tend to look certain ways and female bodies tend to look other ways. But actually, broad variation exists in primary and secondary sex traits. So it's actually more useful to think of this as a bimodal distribution rather than a binary distribution. For more information on that, follow me along to the next slide. So we tend to think of male and female bodies as opposites, with men being one way and women being another way. But there's actually a lot of variation within categories and a lot of overlap between categories. What I mean by that is that there are, for any sex trait you care to identify, there are lots of different presentations of that sex trait within each sex category. So, for example, we might look at something like external genital size. So, I don't mean to embarrass anyone. I hope you're listening to this in the privacy of your home. But the penis and the clitoris are analogous structures on human bodies, meaning that when the androgen wash happens, the structure that's the clitoris in women is triggered to develop into a larger structure if the fetus is male, meaning that a penis generally develops. But penis size varies widely from what we would consider a micropenis, which may look like an enlarged clitoris, all the way to very large structures. Similarly, clitoris size can vary from barely detectable to looking like a small penis. So there's a lot of variation within categories, with most people falling somewhere in the middle. There's also a lot of overlap between categories, meaning that for a lot of sex traits like that we tend to think of as dimorphic, there are a lot of male-bodied people who are similar to a lot of women, and a lot of female-bodied people who are similar to a lot of men. We'll look at some examples in a minute. But my point is that the idea that sex categories are opposite or complementary is a narrative more than a reality. There are certainly anatomical differences in what we generally call male and female bodies, but those differences aren't as stark as we tend to depict them. Here are some examples. So this is a simple frequency distribution of men's and women's height in inches, and a frequency of how often each height occurs for men and women. So we see that women have a mode, or a peak occurrence, of about 60 inches, and go as low as 55 inches and as high as about 78 inches. Men also have a lower end of around 55 inches, way out in the left-hand tail of the distribution. They have a mode, or most frequently occurring value, of about 70 inches, and they reach heights of about 85 inches, which is significantly taller than the outer tail for women. What this means is women on average are shorter than men on average. But if you look at the middle of each curve, you see that there's a great degree of overlap. So between about 60 inches to about 70 inches, many men and women fall into that range under the curve, which means that there's more overlap than there is difference in women's and men's heights. I couldn't find a good visualization of what we would call athleticism or muscle mass in men and women. So I did what I consider to be a pretty good proxy for that. I used to be a runner, and the event I preferred was the half marathon. And so this is a distribution for men and women of finish times for a half marathon. And you can see that men have the quickest finish times. Women, even in the left-hand tail of the distribution, meaning women's shortest times, don't finish as quickly as the quickest men. And even out in the right-hand tail, men don't finish as slowly as the slowest women. And we see that men's mode is faster than women's mode. But we also see in this shaded area under the curve that there's a great degree of overlap between men and women's times, with gender not being, a perfect predictor of how quickly someone will finish. If men's and women's bodies were opposite, we would expect to see the red curve way out here to the left, not even touching the women's curve, which would be way over to the right. What we see is that some women are about as quick as a lot of men, and some men are about as slow as a lot of women. Or in other words, athleticism is largely similar for men and women, with differences existing in the tails. For a long time, people also thought that personality traits differed systematically for men and for women. That is, that brain differences between men and women accounted for personality differences or behavioral differences. There are 5 personality traits that psychologists call like the big 5, that are generally considered to be inborn or stable personality traits, and one of them is agreeableness. Agreeableness means how likely you are to cooperate and be kind and generous to other people. And women are generally stereotyped as being much higher on agreeableness. If we look at these distributions, we see again, women are on average higher on agreeableness than men, but there's a large area of overlap in agreeableness. In fact, most of the curve is under that middle area where men and women overlap. So there are some men who are lower on agreeableness than all women, and there are some women who are higher on agreeableness than all men, but most people, male or female, overlap somewhere in the middle of that big distribution. Hi friends, the next thing we're going to talk about is people who are intersex, meaning they don't fit neatly into one sex category or another. They have different genital arrangements or chromosomal arrangements than we would expect. Historically, people who are intersex have not been treated well, especially babies and children who are born intersex. And so, unfortunately, in talking about these children, we're going to talk about harmful things being done to them. This may be very difficult for some people to hear, and so I want to encourage you to be emotionally prepared for it, and I want to encourage you that it's okay to skip the next slide if you can't handle that. We should also understand that many people don't fit into the sex binary at all. We can think about people who don't fit into the gender binary pretty easily, but there are also people who don't fit into one or another sex category in an obvious way. So these persons are typically called intersex, and they represent almost 2% of births. So between 1 and 2% of births are intersex. This is more than the number of persons who are deaf, or who are albino, or who are identical twins. So if you know identical twins, or someone who's deaf, or someone with albinism, then you know someone who is intersex. Intersex births are persons who have sex traits that are not obviously male or female, or have some sex traits of males and some sex traits of females. So this can look like a number of different things. It can look like ambiguous genitalia. So genitalia that doesn't clearly look like a penis or a vagina, doesn't clearly look like labia or testicles. Um, it can also look like having masculine primary sex traits, but then having feminine secondary sex traits. It can also look like having, for example, a vagina and a very enlarged clitoris that looks like a micropenis. Or it can look like having testicles but no penis. It can look like a lot of things. There are many variations in how people's genitals can be arranged, and many people have intersex conditions. It can also look like having a genetic sex that doesn't match your anatomical sex. So, for example, there are certain people who are known as androgen immune males, meaning that basically they have an XY chromosomal arrangement, but the androgen wash doesn't take. They essentially, their bodies don't respond in the typical way to male hormones. And so, although they have chromosomal arrangement that would indicate that they're male, they end up having feminine bodies with a vagina, usually pretty small breasts, usually very little body hair, and feminine face and feminine musculature. They may be tall, but they definitely look like women. There are also a number of different intersex variations that we haven't described. What's important to understand about intersex infants is that historically our society has not respected the sex identity of these babies. Typically, our society has medicalized these babies, meaning we've thought of them as an aberration or a failure of sex expression. And what we typically do is assign them a gender at birth, meaning rather than just saying, wow, you're not clearly one or the other of these categories we've made up, we say, you need to fit into one of these categories. So what we're going to do is just ignore that you're different and treat you as if you fit neatly into one of these categories. And often in order to do this, parents make the decision to genitally mutilate their children. Generally, on the advice of doctors, they make the decision to surgically alter their children's genitalia to look more like one sex or the other sex as we've defined them. So this has been done to many, many, many children in our society, and most people don't talk about it, and many children may not find out this has happened to them until much later in life. So often genitals are surgically altered. Sometimes hormone therapy is used to simulate sex dimorphic development as we expect that it should happen, and to trigger changes at puberty associated with the child's assigned sex. We also socialize these children who don't neatly fit into one sex category or another as if they did. So we raise them associated with one sex, we raise them in the gender associated with one sex. It's worth noting that for reasons related to the ease of performing some surgeries rather than others, and replacing estrogens rather than androgens, most intersex infants who are genitally altered at birth are raised as women instead of men. Gender is a set of cultural and social meanings created around sex. It's about what we expect people to do and how we expect people to behave and how we treat people based on what we perceive their sex category to be. When I say that gender is socially constructed, it means that while physiological differences in sex traits are pretty stable over time and place, the meanings we build around those traits are very different. People in different cultures and in different time periods had very different views on how men and women should be treated. For most of human history, for example, there was no idea that men were necessarily better at physical labor than women. It was generally understood that men could lift more weight, but the fact that that meant women shouldn't work in the field or work on the farm or work in certain, occupations wasn't a given, and still isn't in certain places around the world. Um, Gender is socially constructed. It's learned throughout the life course. We learn how to perform gender. So if you've ever been told, boys don't do that because boys don't do that, or don't do that behavior, it's not ladylike, or girls shouldn't do X, Y, or Z, that's learning gender. We also learn gender in much more subtle ways, as we'll talk about later when we talk about gender socialization. Um, Gender is also performed through social behavior. We enact our gender through the ways we act and interact. And as I alluded to before, gender varies greatly across time and place, and we're going to look at some examples now. So we in the United States have a particular set of cultural ideas about gender. But those ideas exist in our specific social and cultural contexts. And historically and around the world, they've been very different. So, next, we're going to talk about how gender expectations and gender roles have varied across time and place. So, one example of gender expectations is how people are dressed and how children are treated based on their perceived sex. And an interesting thing is that the idea that children should be treated differently based on sex is fairly novel in the West. So, for most of US history, boys and girls were treated very similarly until they reached a certain age, usually around puberty. Um, Children were seen as kind of ambiguous in a lot of ways, and gender was one of those ways. In fact, the word girl in English used to just mean child. It didn't become associated with female children in particular until around the 1600s. Until then, children were just called girls. Um, in fact, it might surprise you to know that every child pictured in these images are boys. On the left are three boys who are brothers. This picture was taken in the 1800s. And on the right is US President Theodore Roosevelt when he was about 3. So these are all boys pictured in this image, in these images, until about the mid 1900s, 19 teens perhaps, 1920s. Girls and boys were dressed very similarly until they reached puberty. And if you think about the practicalities of toilet training and diaper changing, skirts just made more sense. Many indigenous North American cultures recognized at least 3 and as many as 5 different genders. So, for example, many nations recognized 5 categories. What we would call cisgendered women, people assigned female at birth who grew up to be women. People we would recognize as cisgendered men, people assigned male at birth who grew up to be men. People of either sex assigned at birth who transitioned to the other gender, usually around puberty, what we would call trans people, as well as a separate category or 2 separate categories of two-spirit. Two-spirits were gender non-conforming people, people who were assigned a sex at birth, but who exhibited elements or features of both genders, usually leaning more toward one than the other, and assuming the ceremonial roles, the dress, and the pronouns of one gender or the other, but enacting some of the rituals and duties and behaviors associated with the other gender at the same time. This term, two spirit, is still in use today, as we'll talk about in a moment. Some examples of people in indigenous American nations who fit into some of these categories. And here I'm trying to use the indigenous names because they have particular meanings for their nations. The person pictured on the left is Wewa, who is Zuni. And she was a Lamana, which is a person born assigned male, who grew up to take on ceremonial female roles. She actually became an important Zuni leader, which is one reason we have history of her. In the middle panel, you see two individuals pictured. The person on the left is Oshtish. Oshtish is from the Crow Nation. She was historicized by the Crow historian Pretty Shield. And in this history, we know that Oshtish, who was assigned male at birth, but performed feminine roles as a two-spirit person, fought very bravely in the Battle of Rosebud against the Lakota and some Americans, earning her name there, Oshtish, which means she finds them and she kills them. Oshtish, because she was a two-spirit person, was believed to have special healing powers and special connection to the spiritual world, and as such was a healing leader and medicine leader of the Crow Nation. The person pictured to the right of her is believed to be her wife, whose name we do not have. The Crow also had two spirits who were assigned female at birth. So, for example, a famous Crow chief named by American historian Jim Beckworth as Pine Leaf, but whose real name was Biwa Chitichish, which means woman chief, was a chief of the Crow people in the 1800s, who fought against Lakota and American and Blackfeet people. The person to the right, finally, is a contemporary two-spirit person from the Cheyenne River Sioux tribe, and this is a person who is assigned male at birth, who is currently wearing women's regalia at a powwow. So his name is Sheldon Raymore. So it's important to recognize that this idea of two-spirit people, despite the efforts of American colonists to wipe out this gender identity and gender variation, indigenous American nations still recognize a lot of variation in gender identity. Another culture which has historically admitted of more gender variation is the Indian subcontinent, the cultures of the Indian subcontinent. Here, people on the left are from Bangladesh, and people on the person on the right is from India. These people are all Hijra, which is generally people who are assigned male at birth or who are intersex, who choose to live as women. And they are also believed to have ritualistic powers, special spiritual gifts. However, they're often treated with social contempt and disrespect, much like we would conceive of gender nonconforming people being treated in the West. They're often looked at with suspicion because it's believed that they have the ability to bless and to curse. And they often make their living through performing rituals at births, at marriages, and at funerals. Um, so these are all Hijra people who are considered part of a third gender. Cultures in Europe, especially Eastern Europe, have also historically had different gender categories for people who we might consider gender nonconforming. Um, in Albanian history, for example, there has been a category called Bernesha, which roughly translates to sworn virgin. And these are people assigned female at birth who wish to live as men, often for the social and economic advantages that entails. Um, and so historically, they've been expected never to marry, hence the term sworn virgin. And in exchange, they're socially accepted as men in their community. As women attain more gender parity, this tradition is dying out. However, the person on the right, this picture was taken in late 90s, early 2000s. So this is a contemporary Bernesha person, where the person on the left is an older Bernesha person. But historically, that's been part of Albanian culture. Another example of cultural variation in gender roles and gender expectations is the example of the Basha Posh in Afghanistan. So historically in Afghanistan, boys were given certain social rights and freedoms that girls were not. And if you had a family of all daughters, it was very useful to also have a son who could basically take social responsibility for caring for your daughters. So often the oldest child in a family would be raised as a boy, even if they were female at birth, until at least puberty, at which point they would transition back to living as girls. And this tradition is known as Basha Posh. Now that we've talked about some variations in gender identity and gender roles and gendered behavior that exist across time and place, let's think about how gender socialization works and how we learn what our expected gendered behaviors might be. The first thing I want to talk about is gender status and gender roles. Gender is an ascribed status, meaning it's a category that we're placed in at or before our birth. Interestingly, I was born right around the time that ultrasounds were getting pretty accurate at revealing a person's anatomical sex in utero. So I was the first person born in my family whose sex was known before birth. And you can tell in photos of me versus my older cousins, I'm the first baby whose gender was very obvious from the time I came home from the hospital in those early pictures, because all of my cousins had been wearing white or yellow or green clothes, and I was in head to toe pink. So I was right at the cusp of gender being assigned before birth, where for my older brother and cousins, we learned the sex of a baby and assigned its gender at birth. So gender status, the gender that you're assigned at or before birth, is attached to certain social roles, which, as we talked about in Chapter 4, are sets of expected behaviors based on a status. So our gender assignment comes with a set of roles that we're supposed to undertake, a set of behaviors we're expected to do. And there are also norms attached to those gender roles. So ways that things we're expected to do, behaviors we're expected to enact, but also ways we're expected to think, and feel. And these norms and roles change from time to time and from place to place. So, for example, in the United States, we tend to think that women are more talkative and more expressive. Um, and we tend to take this as a marker that women are more emotional and less rational. However, in certain other cultures, the opposite is believed to be true. Men are thought of as more expressive and more sensitive, and this is seen as as evidence that men are more intellectually developed than women. Women are seen as quieter and more objective and logical, and this is seen as evidence that women have less insight. So, in both cultures, whatever is associated with women is thought of as negative, but the trait ascribed to men versus women is very different. So these norms and roles change from time to time, and place to place. So gender socialization is the idea that we learn to perform gender throughout our life course. So just like other forms of socialization, it doesn't stop in childhood the way we normally think. We're socialized to our gender throughout our lives. We learn to do gender through the same ways we learn to do anything else. We come to understand our gender status and expected gender roles through interaction with significant others, usually family first. So we learn how men or women or boys or girls behave through interacting with our parents, through interacting with older siblings, cousins, friends, schoolmates, etc. And we learn to do these behaviors in the same way we learn to do anything else. I was taught which fork to use at the table, and also that whistling was unladylike at the same time. I was taught to sit still in my desk and to sit with my ankles crossed around the same time in life. These are gendered behaviors that I'm learning right alongside non-gendered behaviors. We model gendered behavior on role models. So we imitate people who we think model our gender identity. And we may do this on a subconscious or unconscious level. But we identify certain significant others as gender role models and then mimic their behaviors. We also engage in reflected appraisal around gender as our gendered behavior is affirmed and critiqued. So I was what used to be affectionately called a tomboy, meaning I was a little girl who engaged in a lot of traditionally masculine games and play. I did a lot of things that were seen as boyish. And I was called a tomboy. And my grandfather on my dad's side used to criticize me for this a lot. He would say things like, keep playing like that, you'll grow into a fine man someday. And I used to eat like that when I was a little girl like you, and look how I turned out. He was teasing me, but he was also letting me know that what I was doing was not appropriate for my gender. So I learned gendered behavior through reflected appraisal. And according to sociologists, that's how we all learn it. So the following links are, I'd like you to look at them, but they're kind of just for fun. The first one is an experiment in which toddlers were dressed as either their assigned gender or another gender, and were then given to adult volunteers to play with. And the experiment was which toys would the adult volunteers try to use to play with the babies. The second is from an academic study from the 2000s on greeting cards welcoming a new baby. It's a content analysis in which the authors looked at the language and imagery used in girl cards versus boy cards and cards for a baby of indeterminate gender. It shows that gender socialization and gender role expectations are actually assigned to babies even before birth. And finally, an interview with a neuroscientist named Gina Rippin, in which she examines the nature versus nurture argument of sex and gender. Now that we've talked about the concepts of sex and gender and how we learn to do sex and gender, I want us to talk about some theoretical perspectives on sex and gender. The most obviously relevant theory to discussions of sex and gender is feminist theory. Feminist theory posits that throughout history, women have been treated as secondary. This is the basis of work on the topic by Simone de Beauvoir, The Second Sex. It's the idea that men have been taught as the basis for our knowledge and our thoughts and our standards, and women have largely been seen as variation on men. This has been evidenced by political disenfranchisement. Women have been disallowed from participating in political processes like voting or holding public office. Lack of personal and social autonomy, limits placed on women that weren't placed on men. For example, in the United States until the 1970s, married women couldn't have credit cards or take out bank loans or buy homes in their own name. Medically, married women have historically needed husbands' permission to do anything related to their reproductive health. There's also the concept of instrumentality versus ornamentality, which means that men and men's work are treated as important and necessary, where women are put in positions of being largely decorative. Feminist theory addresses the marginalization of women and women's perspectives. So that women's perspectives on literature, on history, women's contributions to science, and women's perspectives on current events and political issues have been pushed to the side, so that you have in literature authors and women authors, in sports, athletes and women athletes. In history, you have entire books about wars and politics and the realms of men, with little inserts about women's contributions and domestic life, which is all we hear about the women of the historical time period. Feminist theory seeks to recenter the experiences and knowledge of women, and to argue for their greater inclusion and enfranchisement. A branch of feminist theory is the idea of masculinity studies or men's studies. This is a theoretical perspective that's really developing since the 1960s, since the rise of feminist scholarship, and really seeks to look at, examine, and critique the social meanings constructed around maleness. The most important concept within masculinity studies is what we call hegemonic masculinity. Hegemonic means strict and overarching standards for how something is to be done. So hegemonic masculinity relates to our standards of what it means to be a quote-unquote real man. That is, to be a truly masculine, truly manly man. Standards of hegemonic masculinity in our society are defined in contrast to femininity. That is, if women do this, real men do it differently. If women cry, then real men are stoic. If women are kind and gentle, then real men are strong and aggressive. If real men are, or if women are sexually passive, then real men are sexually aggressive. So it describes masculinity in terms of opposition to femininity. You can view hegemonic masculinity as a rejection of anything feminine. This places men in a position of fragile privilege. Here's what I mean. You may have heard the term fragile masculinity thrown around. And fragile masculinity, or the idea of fragile privilege, relates to the idea that when there are strict rules defining who belongs to a group, it's really easy to fall out of favor with that group. If being a real man means conforming to a set of strict rules defined in contrast to femininity, then doing anything feminine at all can crack your pedestal. It can push you off of the position of privilege that you're in. If you are caught doing something that violates the standards of being a real man, which is very easy because these rules are very strict, then you lose a lot of the privilege given to real men by our society. If you don't believe me, look what happens to men who are seen as effeminate. If a man is seen as doing things in a feminine way or doing things like a woman, then he's generally derided and treated with disrespect. This enforces gender hierarchy on men and women. It enforces on men that they have to fit these often exhausting and impossible standards of what it means to be a real man, while at the same time enforcing on women that they're supposed to be submissive and men are supposed to be in charge. Hegemonic masculinity is also a useful framework for viewing our society's approaches to sexuality. So, under hegemonic masculinity, any sexuality associated with real men is privileged. Being feminine is devalued in terms of sexuality. So, anything women do in bed is seen as less valuable than anything men do in bed. I'm going to give you an example, and it's going to require me to use some crude and threatening language. I don't want to upset anyone, but please be aware that I'm about to say something vulgar. I promise it's for illustrative purposes and not to upset anybody. If you think about how we insult men or threaten men who are doing things we don't like, we often use expressions that refer to things women do in bed. So, for example, if you tell someone to eat a dick or suck a cock, you're never telling them to go do something pleasant or to have a nice sexual experience. You're saying it in an attempt to degrade or belittle them by accusing them of doing something that women do sexually. Similarly, you can think of other examples of things related to feminine sexuality that we use to insult or threaten or belittle men. Similarly, emotional and interpersonal intimacy is devalued. Things like cuddling and kissing and bonding with someone you're having sex with are seen as parts of feminine sexuality and are devalued or belittled when men do them. Sexuality is also constructed as active versus passive. That is, sexual scenarios are discussed in a way that defines one partner as doing sex to the other partner, such that there's one active partner and one passive partner. Of course, this isn't how human sexual intercourse actually works. Both partners or all partners are active at the same time. But in hegemonic masculine discourse, we describe one partner as doing sex to the other partner, and the active partner is valued more than the passive partner. Under hegemonic masculinity, men's heterosexual sexuality, that is, men's sexuality with women, is expected to follow certain scripts. Under these scripts, men are supposed to be the sexual aggressors. That is, men should initiate sex with women. Men should pursue women to have sex with them. And men should be active and aggressive during sexual encounters. Men are also expected to want sex all the time. Under hegemonic masculinity, men are really only allowed to experience three emotions: anger, hunger, and horniness. And if men are not sexually desirous all the time, it's seen as something being wrong with their libido or something being wrong with their sex drive, rather than just admitting that different people want different amounts of sex at different times. Um, Men are expected to be the active partner in sexual encounters, so they're expected to do sex to women. Men are also valued more if they have many sex partners, because that proves that they're meeting all the other standards of being sexual aggressors, wanting sex all the time, and doing sex actively to women. It shouldn't be surprising then that under hegemonic masculinity, women's sexuality with men is supposed to be exactly the opposite. Women are expected to be sexually passive. Women are not supposed to pursue men for the purpose of having sex with them. Women are supposed to withhold sex. Women are supposed to be selective about who we have sex with and when. And we're only supposed to want sex in certain contexts. For example, good women are women who only want sex in the context of a relationship, or at least in the context of someone with whom a relationship could develop. We're not supposed to want casual sex. The way we talk about sex between women and men, we talk about women giving sex to men. Again, I have no intention of being vulgar, but when we describe sex acts between men and women, we describe women as giving sex to men, and men as doing sex to women. You can all think of some examples. Women are also expected to have fewer sex partners. So women are supposed to be selective about the people we have sex with, and we're also expected to be more sexually reserved, and not to have as much sex with as many different people. Under hegemonic masculinity, sexuality between men is highly devalued. Sex between men is seen as a threat to the system of male dominance over women, specifically because it involves a man playing a passive role in sexuality. Now, of course, I'm not saying that anybody in a sexual encounter is passive. When we have sex, we're all active. But the roles that are assigned to the receptive partner are seen as passive. Therefore, any man who undertakes a passive role in sexuality is seen as doing something feminine and therefore unworthy. Any perception of femininity is viewed with contempt. So when men do things that are assigned to women, such as having sex with men, under hegemonic masculinity, that person and their behavior is seen as disgusting or contemptuous. It's seen as threatening to a system of male dominance because it puts men in positions that we think are reserved for women under this system of what it means to be a real man. Under hegemonic masculinity, women and their sexuality is devalued in a different way. So when women have sex with women, this behavior is generally fetishized under hegemonic masculinity. This brings up the feminist concept of the male gaze. The male gaze is the idea that women are always aware of how men are looking at us, and that feminine culture women's culture is always subjected to the presence of men's interpretation. So, if you think about the perfect example of this kind of fetishizing devaluation of lesbian sexuality, you can think of men's fascination with lesbian pornography. Now, lesbian pornography is generally not pornography designed to be viewed by lesbian women. It's generally pornography featuring two women doing things that are meant to appeal to men. So this idea of the male gaze is that women even when they're having sex with each other, are viewed in light of men's desires. Uh, One reason that feminine sexuality or lesbian sexuality is fetishized and devalued and marginalized in this way is that lesbianism is also threatening to the system of male domination. Like gay sex between men, the idea that women can have sex with each other and obtain sexual fulfillment without the presence of men threatens men's perception of themselves as the necessary and kind of most important partner in a sexual relationship. Now that we've talked about feminist theory and its offshoot masculinity theory, let's talk about some of the classical theories that you're going to be more familiar with from the first unit of the course. So, through a lens of structural functionalism, gender is typically viewed in terms of division of labor. This perspective comes from a work by Emile Durkheim called Division of Labor in Society. And the idea is that men and women occupy separate spheres of work, that men work outside the home in the public sphere, and women work inside the home in the private sphere, and that these two spheres of labor complement each other so that all the work gets done. Now, of course, this misses the critique that, yes, these two kinds of work need to get done, but there's no reason they can't be done by the same people at different times. But the idea is that women can become skilled at the work of the household and men can focus on a profession when women and men divide labor along gender lines. For Durkheim and other structural functionalists, gender division of labor and separate gender roles relate to organic solidarity, where men and women cohere or stick together because of differences in their behaviors and in their duties. Next, we'll talk about conflict theory. And notice I've called this Marxist conflict theory because there's also feminist conflict theory, which is different. So, in talking about classical Marxist conflict theory, gender is a source of false consciousness. Under capitalism, the subordination of women leads to the subordination of all workers. When women are subordinated, treated as less valuable, paid less, marginalized, women by necessity become more dependent on men. If you can pay women less, you can make them dependent upon men for subsistence. And when you make women dependent on men, this in turn makes men dependent on their bosses. So if you think about men's reasons for working, they often say that they work so they can provide for their families or because they have mouths to feed. This is a reference to the women and children who depend upon them. But if you consider that in a society where women and men made similar or the same amounts of money and women were free to be independent, that men could exercise more choice in their work. They could risk unionizing or arguing for higher pay or otherwise standing up to employers. Whereas with women and children dependent upon them, men are beholden to their bosses. So from a Marxist perspective, full equality between genders is ideal and also necessary for revolution. In other words, until men and women stop arguing about gender issues, Marx would say, we'll never recognize our common plight as oppressed workers and seize the means of production. We've already talked about symbolic interactionist perspectives a little bit when we talked about gender socialization. For symbolic interactionists, we learn to do gender through reflected appraisal, and gendered behavior is socially enacted. Erving Goffman, the theorist who gave us dramaturgy theory and the concept of stigma, also wrote a book called Gendered Advertisements, in which he argued that we use different props and face work and presentation of self to advertise our gender. That is, we act and behave in ways that are specifically designed to emphasize our masculinity or femininity. Symbolic interactionists also argue that gendered scripts are socially enforced. That a major reason we undertake the gendered behaviors we do is so that we will be socially approved of and avoid kind of social criticism or social embarrassment. These are all questions I would like you to think about, and I would like you to choose one or two of them to discuss or ask a question about on the discussion forums.